What are your main responsibilities as an athletic trainer at a Division I college?
Primarily take care of injuries, evaluate injuries, assess them, refer them to the physician if they need further evaluation, assess illnesses, refer them to the doctor as needed, refer them for any other psychological needs, nutritional needs to the appropriate professionals, cover practices, cover games for in-season teams, handle appointments for outside appointments, insurance, we have to do pre-certifications, just overall just try to take care of the athletes' general health and try and manage their care wherever they needed help, even though it's supposed to be just stuff that affects athletics, it tends to be outside stuff too. Okay.
When an athlete comes to you with an injury, what's the normal protocol?
To get a full history, ask them how it happened, when it happened. Athletes tend not to give enough information, so you just have to ask them a lot of questions, try and get as much background as you can. Previous history, previous injuries, and then do evaluations. We're taught special tests, and when we're in school for certain injuries, to evaluate range of motion, strength, look for any deformities, discolorations. If it's something that I can manage and manage my own, if it's something that I feel needs further assistance, we refer them to our team physician.
Are there ever times when you feel pressure from the coaches and or players to put participation before the athlete's personal health?
Yes, definitely. Probably more so the athlete than the coach. Obviously, if it's a starter, the coach is going to want to get a person back sooner than later. Once again, it kind of depends on time of year, time of season. Even our team physicians behind us with that in regards to if it's their senior year and there's 1 or 2 weeks left of the season, we'll treat an injury differently than if it's the beginning of the season. But ultimately, you have to look at not just the health for that week, but if you rush them back too soon, then it's going to affect them for the rest of the season, and they may not be as effective. So ultimately, as you may not be able to do it as quickly as the athlete or coach wants to, but we may accelerate things during depending on when time of season is and do the individual. But ultimately, you want to treat everyone and get them healthy so they're not feeling the injury longer than it should. But ultimately, if you rush them back in, they're going to be feeling the injury longer than they would have liked and you would have liked, or the effects of the after effects of the injury.
Do you ever feel obligated to focus on getting a particular player back on the field faster based on their role in the team's success?
Not me, at least, and not for the sports that I work. There's not the same pressure there are with your higher tiered sports that are in the media a lot. I look at the athlete's current health, and then I look at their health in the future and how it's going to affect their injury or illness and affect them in the future. So tend to be a little more aggressive with injuries in season versus out of season. Out of season, there's more time to recover. In season, depending on the time of the injury, will also dictate how aggressive we are with treating the injury and returning them back to play. Ultimately, we always care for each injury the same way. It's just how aggressively do we try and get them back. How aggressively do we tape it, brace it to push them through it quicker than we would have if it was necessary this summer or the off season.
What changes do you think need to be made for coaches and athletes to focus more on getting back to being healthy than back on the field?
The biggest thing is, number one, parental support helps, which I seem to get a lot with the teams that I work. But number two is just reminding the athletes that their sport is just 4 to 5 years out of their career, yet they have a long life to live. And especially with females, talk about childbearing, giving birth, being able to pick up a child, take care of a family. If there's certain injuries that if you're not smart about it, it's going to have long-lasting effects. So for me, I just kind of remind them this is one season, but you have a whole life ahead of you.